Eye bags can be a very annoying problem for many people. In order to understand the treatment for eye bags, it's important to understand why do you get eye bags in the first place. Well, there's naturally fat found around the eye. When you're young, it's behind a nice tight membrane, it's kind of held back. However, through a combination of age and frequently genetics, you'll notice that the fat below the eye begins to push forward. As it does that, it begins to create that bag below the lower eye area. That bag is accentuated because there's being a shadow cast from the light above on the rim right below, often referred to as the tear trough. So when it comes to the treatment, there are actually three ways to treat lower eye bags. The first one is makeup. You can just simply try to camouflage the area. It doesn't do the greatest job, but it can be done. As the bags tend to get worse, you'll notice the makeup starts to cake a little bit more, and it becomes more and more difficult to treat. The next option you have is to try to camouflage the problem. As I mentioned, there is that shadow that's being cast from above over the eye bag itself, creating the shadow in the tear trough area. So what we like to use in that area then is fillers. We're not actually treating the eye bag with fillers, but we're treating the cosmetic effect caused by the eye bag. So what you do with that is you're trying to blend the transition between the eye bag right here and the nose and the cheek below it. That's a simple office-based procedure. There are several different filler options available. I personally like to use Restylane. The reason I like to use that one is it doesn't tend to pull in as much fluid or as much water after the injection, so it doesn't lead to as much of a puffy eye. And because it is a nice thin filler, it doesn't leave much, or doesn't have much of a risk for having any lumpiness afterwards. For those patients who are looking more for a permanent solution as opposed to the temporary solutions, then surgery becomes the option. There are three different approaches for lower eyelid surgery which could be addressed at your time of your consultation. If all you have is the lower eye fat bags without any extra skin, one of the treatment options is an incisionless or a scarless procedure where an incision is made in the pink part of the eye right there simply to address the eye bags. So again, there are multiple treatment options available for eye bags. It's important to realize there are pros and cons to all of them, and all of these can be discussed at your time of consultation with your healthcare provider.